everyone, and welcome to Black Economics TV. We have a special guest with us today, Dr. Ashish. She is a medical doctor who now practices Ayurvedic medicines and other natural herbal cures. She's also an expert on fertility. I'm really pleased to see you, Dr. Ashish. So I know we're going to learn quite a bit from you. So please start off by giving me your background. Tell us about your upbringing and your education, please.
Good morning, Dawn. Thank you for having me here. It's a pleasure. So my upbringing was in India, as you can imagine, probably from my name and tell. But I grew up in India and always wanted to become a doctor. I actually have a little bit of history to that because I had a heart operation when I was 7 years old.
Oh, wow.
And this is to what commonly is called that everybody is born with this hole in their heart, which is a physiological thing. And it closes by itself with every person by the time they're 2 years old. And in some few individuals, it doesn't close. So in my case, it didn't close. So I had to go through an operation, heart surgery, at the age of 7. So I had very early on interaction with doctors and medical professionals and you name it, So I was in the hospital for about a month. So because of that, I feel that I got really, really aligned to do what I'm doing now, because I just loved how doctors were, their aura, their interaction with patients and all of that. So I wanted to become a doctor, and I wanted to become, didn't qualify for MBBS, which is the mainstream medicine, and then qualified for natural medicine, Ayurvedic medicine. So in India, Ayurvedic medicine and main doctors, they can work side by side. So in India, I am qualified as a doctor, and I can do certain things which I'm not allowed to do outside India. So it's just how it is. But that's what I trained in, and then I came here to the UK in 1998. I then again wanted to study medicine, and then ended up doing herbal medicine. So I did herbal medicine degree, did masters in herbal medicine. And now over the years, I'm a trained dynamic yoga teacher. I'm a trained NLP and hypno specialist as well. So all of that. So, and a lot of things over the years that I have added to my skill set, because my idea is that when I have a patient, I don't want that patient to go away anywhere. I want to be able to look after that patient fully. And that's what I do.
So would you say you are an alternative to traditional GPs?
Yeah. So I'm not a GP and I'm not a medical doctor. I'm a natural medical doctor. So natural medicine is my specialty now for 32 years. It's been 32 years since I've been on this path. So yeah.
Okay. And you have a specialist clinic in fertility. Tell us about that.
Yes, Harley Street is where clinic is. Fertility is something that I started with actually when I was in India, and I was training with obstetrician and in a gynae hospital, because I thought this is one profession which cannot go out of business, right? So there are always going to be babies, and it's just fascinated me. I think is the biggest miracle that women can actually produce a whole child, those who want to, right? So I was really fascinated by that. And that's how I started. I worked in gynae and maternity for 5 years in India. And then it came round circle. Here I started working with women, because as a complementary medicine practitioner, you see more women through the door anyway. It's 80% women, about 20% or less men. And with that, they have issues to do with gynae issues, period issues and miscarriages. And I started working with them. And then I have my own journey of IVF. I have IVF twins. And then my story is really 1%. It's 1% of the people who would have a story like me, which is very successful. First time successful IVF, and I have twins from that. But it's then when I started meeting other women, I realized that women are going through cycles and cycles of IVF. And I thought, why are we not doing anything natural? Why are we not supporting these women? So that's where the idea started from. And then slowly I got more and more and more into it. And it's a ticking time bomb that women are sitting on. So that's how I got more passionate about natural medicine with fertility. And I support now, especially London-based CEOs and women who are working women mainly, and they are going through IVF and they don't know what else to do. So I work a lot with them, and I also work a lot with women who are 40 plus, because, as professional women, that sometimes we leave it late, or it just gets left out till late that you want to have children. So I support those women a lot.
So would you say that you increase the chances of IVF becoming successful? And if so, what percentage?
Yeah, I like to keep it conservative. So I say I increase about 50% chances of anybody who's going through any fertility issues. And we know this, we also know this from studies, from data that I have looked at, that when you prepare even minimal 3 months, if you prepare your body, whether you're going for any other sort of medical treatment as well, you have 50% more chances. So just imagine if then you are doing natural medicines and all the therapies that we do in the clinic, you have got much better chance. So, yeah.
Okay. And where is your clinic based?
Yeah, we are in Harley Street in central London in United Kingdom. We are also at 2 other locations as well, but main one is Harley Street. But I am also based in High Street, Kensington, and also Holborn, which is City of London. So it's all around London.
Yeah. And do you have clients from around the world?
I do. I see patients internationally, of course, India, common one, Dubai, America, Canada. I see patients because consultation can be easily done online. And then we send them medications. The only part we can't do online is obviously therapies. But I see international patients, yes.
All right. Okay, great. All right. Now tell me about the other side of health with regards to the common ailments that people are suffering from. Heart disease being a top killer, then we've got diabetes, obesity, high blood pressure, and so on. Tell me about health.
So general health is also something that this is another side to my work, which I've started. It's actually not separate, but we are putting it out as a separate thing, which is called rejuvenation of your health. So how can you rejuvenate your health? Even when you think that you are 100% healthy, you can still rejuvenate your health. Yeah. Let alone for those people who have got issues, as you mentioned, all these issues related to their health. And what I see in my practice, and I've seen it over the years, I've seen it with my health, I see it with my children's health, who are almost herbal kids, because I don't use medication for them or for myself, is that how can we use natural ways of living, which becomes medicinal, which becomes what we call therapeutic, that you eat 90% of the time, if you eat according to certain principles, then you are never going to have issues related to your gut. Yeah. Because I see that I'm a very healthy individual. I don't get sick. Even through this whole period of what has happened to the whole world in the past 4 or 5 years, I haven't had anything. And same with my children as well. And I see this for the other people also. So my idea is that, how can you keep your health at the best? And I'm very passionate about women keeping their health on top, because as a parent, as a mother especially, you have no day off. There is no day that you can think, okay, I'm now sick today and I can't cook for my children. What if you have dependent children? You have to cook for them. You have to look after them. I am a single parent. I'm the only parent. So I know how it is. And that's why I am very passionate about women, and not only just women, but everyone, but specifically about women.
Okay. All right. So give us some ideas of the kind of foods we should not eat.
I think everybody knows the common ones. I think if you can drop one thing out of your overall, your diet, your cuisine, is the sugar. It's the biggest killer, is the biggest instigator of all diseases. Okay, from sugar, it's not just the sugar itself, but what it does to your system and the fact that it is addictive. Salt, on the other hand, is not as addictive, I would say, but it's the sugar which is more addictive because it gives you high and it gives you low. And it is the starter of, you have got diabetes, you have got heart condition, because it causes inflammation inside your system. But otherwise, it's not general foods. It's about foods that are good or bad for your constitution. Okay, you have a specific personality, you have a specific personality, Dawn. I have a different personality. What are those foods which are good and bad for you? So if you're a hot person, you should be having cooling foods. If you're a cold person, you should be having warming foods. If you are a dry person, you should be having moist foods. So it goes like that. I'm putting it very, very simply. But it is learning about your body mind constitution. And this concept is very unique to Ayurvedic medicine. This is not something, nutritionists don't do this. So modern nutrition doesn't talk about your personality. Okay. Now with functional medicine, they've started talking about, yes, it has to be subjective to your gut, right? But where does that gut come from? It comes from your personality. So who you are as a person is very important. And common ones, as I mentioned, sugar is the common one. Anything which is, which is kind of not fresh. So canned foods, microwave foods, takeaway foods, easy cooking foods, anything which can be cooked very, very fast is not going to be good for you. You know, you need to have natural ingredients in your foods. And we're not talking about fancy foods. We're talking about making it really simple. Have I answered your question?
Yeah. So are we saying that we shouldn't be having sweets, chocolates, desserts, cakes? Is that what we're saying?
In moderation. And again, based on your body mind constitution, you can always make that sweetness a bit more holistic, bit more natural, bit more better, right? So rather than having, I know I have baker friends, you know, who are baking with different kinds of flours, not just only white flour, right? So how can you make it a little bit more healthier? Even if you're using sugar, can you use white or brown, doesn't make difference, but can you use natural sugar like date syrup? And even though date syrup itself, after a while, will be still very, very sugary, it is very sugary. However, it still has some more nutrition to it as compared to plain refined sugar, you know? So it is about how can we compensate it with something which is naturally occurring in nature, which is much more healthier, a healthier version of it. So that's my take on it. I'm not saying just stop eating cakes. I know some people have that sweet tooth and you like sweet things. Eat it, but there's got to be a regularity. There's got to be routine. You need to understand how it is impacting you.
But what about fruits? Because fruits are quite sweet, aren't they?
Yeah. So same with the fruits as well. Certain fruits like sugar, like grapes, are full of sugar. You know, they are really, really high in sugar. So for that, you need to then know, okay, I'm not the kind of person who handles highs and lows very well. It doesn't go with my personality. Then I need to only have a handful of grapes and not too many. Okay. So this is the kind of wisdom that you need about your body and your mind. And certain fruits, for example, mango, when it is unripe, it is very, very sour. As compared to when it is ripe, its consistency changes completely because it's very sweet. So there are lots of fruits like that, which you can, again, according to your constitution, you can change slightly at what stage would you eat them. Yeah. Do you eat them when they're slightly a little bit more sour, depending on who you are, or a little bit more sweeter? Like I like sweet fruits. Tangy fruits are not really, I don't really enjoy them. So fruits also, you have to be very careful about fruits as well. And that's why only eating fruit, and like so many people do, you know, fruit juice fasting and the juices or smoothies as well. Not necessarily very good for the gut.
Oh, really?
No.
Oh, okay. That's interesting. All right. Now, what about weight loss? How would you suggest that people go about weight loss?
Oh, okay, right. So I have a very, very simple formula about weight loss. And this is a long-term strategy. Short-term strategy is that we have therapies. We have herbal medicines. You come into the clinic, you have those therapies. You will lose 10 kilos in a month. If you go on that full program that we have, you will lose between 8 to 10 kilos. So wherever you start from, that's what you will lose. So that's a fast track way of doing that. Then to maintain it, one thing that I always recommend, you might have heard me saying as well, is that drop your dinner. If you cannot change anything else about your eating habits, about even eating sugar for that matter, but if you can drop your dinners, because most people are eating dinners way too heavy, way too late during their daytime. You know, any dinner which is eaten after 6 o'clock is sitting on your system. It's not being digested how it should be digested easily. So that's my simplest formula to maintain your weight forever. Okay, especially if you are someone who have had weight issues in the past, I don't know, 5 years or so, and you want to maintain going long term in the good range of health. And then, of course, it has to be looked at. What are you eating? Quantity of the food is a big one. You know, what I have found, and I found this with personally with my late husband and with other people, some people don't have this knowledge or wisdom of knowing when to stop eating. You know, and it's a learned behavior, because we learn it as in our childhood. Like my mom, I remember, categorically used to say that if you want to eat two of anything, eat one and a half, because by the time food is going to go into your stomach, it swells up, you will realize that you are a little bit more fuller. So I have that habit. Whereas my husband, when I initially we were together, and he would eat, and every single time after half an hour, he was like, I've eaten too much. And I said, why can you not know when you are full? But he didn't have that switch. And that's why he struggled with weight all his life. Up and not that he couldn't lose, he could lose it. But it's just that he didn't have that stop button or button of, you know, what we call satiety button, that when you know that you're getting fuller is when you need to stop, not that when you are really full up to here. So that I find, you know, habit of how much to put in a plate is really crucial in terms of in terms of your weight. And weight also is a learned behavior in families. If your parents eat more, your plate size, portion size is according to their portion size. It's a known thing. We know this. As compared to if I, like now, same thing I keep saying to my children, eat what you can digest, eat accordingly. So they're always a little bit conscious, so they're not overeating, you know. So it's that. Sorry, what was the question?
Yeah, well, I think you've given some really good hints there about weight loss. So you're saying that people can come to you and you have a program to help people lose 10 kilo.
Yeah.
Lose 10 kilo over how long?
Well, that 10 kilos is over a month. We do a full-fledged program, in-house program. It is with then whole awareness about your diet, about what you should be eating. And that it is no good losing weight if you're going to put it back. You know, we don't want that. I don't recommend it. That's why I don't recommend juices and fasting and all sorts of things. Even if you're doing fasting, if you're coming to our clinic also, it's at least 1 year long protocol. Okay, so you start with us, you have the therapies, then you keep following my advice for at least for 1 year, so that you don't fall back into your old habits, right? Otherwise, anybody, without a doubt, you will put that weight back on. Why? Because you haven't changed the habits.
All right. What about smoking? We all know that, you know, smoking is dangerous for us. What's your thoughts on that? Are there any redeeming features? Because I've heard some people say, oh, it's all right to smoke weed occasionally. It's good for you. What's your thoughts on that?
Okay, so smoking is bad for you. Okay, that's this period. There's no good smoking. In a natural medicine, actually in Ayurveda, we have what we call herbal smoke. So, which is a protocol that we use for anybody who has got lung conditions, who has got conditions where they have got breathing issues like asthma. We use herbs that they can smoke. But that's completely different from smoking nicotine. And overall, smoking is bad for you, and including weed. Now, with weed, if you are a very, very stable person and you know you don't have an addictive personality, then, and you know you will smoke it once or once every 6 months, go for it. You know, it's not going to harm in that sense. But most people have addictive behaviors and you can't stop. The issue with weed is not the weed itself. When we use weed medicinally, you know, we use so many these plants medicinally, and it's a great plant. But it's only when people overdo it, when you are consistently, constantly doing it all the time, and you're doing it too much, is when the issue is.
All right. So in terms of people who are head of households, whether that's mum or dad, do you think it's possible for them to control the health of the whole family in terms of how they shop, how they feed them, how they educate as they go along?
Absolutely, absolutely. It's all about how our habits are, you know. If you want to see somebody's nutrition, you should see their trolleys in the supermarket. It's as simple as that.
Ooh.
Yeah, what they put into their trolleys, what are they choosing to eat? And as I said, and this is studies after studies show the same thing, that childhood obesity, children get all their knowledge because, you know, it's, and I've seen this in person with patients and friends and family, is my portion size is very different from somebody else's portion size. You know, when I put something in plate and I'm going to give a full plate to my kids, is going to be very different from somebody else whose full plate is going to be double the size of my plate. Okay, so it's a behavior that we learn, and behaviors around how we do things in the family is also something that is, yeah, you can, everything that you buy, food that you buy, how you cook it, pots and pans in which you cook, the kind of cooking style that you have, the spices that you use, everything is making a difference to your health and your children's health. And that's why changing diet is the hardest, you know, because if you live in a family of 4 and you want to change diet but the rest of them are still eating the same food, it's very, very difficult to change it.
Okay, so you've written an ebook which outlines some of your guiding principles. How can people acquire this ebook?
Yes, so the ebook is called Rejuvenating You Using Natural Therapies. So simple steps every single day that you can do. It is available online on my website, so they can get a copy from that. Right now, we are giving out 4 chapters for free. So anybody who wants to have that, again, those are also available online. So this website is drashish.co.uk. So they can go on the website and then find out in the shop.
Okay, great. And tell me, what's the difference between Ayurvedic medicines and other cures or medicines?
Right. So Ayurvedic medicine is about, it's an art and science of life. Okay. So this is not just that you are sick now and what herbs can you use. It is also about prevention. How can you always live in a way that you never get sick? And when you are sick, then what can you use to make yourself better? As well as that Ayurvedic medicine is about, how do you live inside your house? How do you live inside a country? How do you live in a city? How do you control the environment around you? So it is also about the environmental health, universal health. It's literally way of life. It's everything around you. It's not just only medicine. So that's the difference between Ayurveda, and that's why Ayurveda is a complete system. It's not just only one small thing. You know, like I'm trained in Western herbal medicine, and Western herbal medicine only talks about plants. It does not talk about your body mind constitution. It doesn't talk about foods, for example. In Ayurveda, it's the main thing. Your diet is the main thing. So Ayurvedic system, we know that it is the oldest healthcare system in the world, and all other healthcare systems have derived from it. We know this. So that's the beauty, and it has been going on for thousands of years. So yeah.
Makes me think that maybe the NHS should also be looking at preventative health in a bigger way, and there's much perhaps that they can learn from this particular system, the Ayurvedic system.
Absolutely, but I don't think they want to do anything preventative. It is sad. I think with NHS, the best prevention that they're doing is they're just talking about things. Okay. So it is like, okay, we are raising awareness. And then what? You raise the awareness about diabetes, but the person now who has the diabetes want to do something about it. They don't have those means because they're not trained in herbal medicines. Whereas raising awareness and then giving tools to actually change it is what we need to do, you know?
Yeah.
And NHS is not focused on prevention. NHS is focused on once you are sick, what to do. And it is almost like emergency medicine. Yeah. I mean, especially what has happened in the last 4 years or so.
Yeah, exactly. Well, perhaps you could be talking to the powers that be in the NHS and maybe try and get a few doctors on your side as well. Have you been talking to any GPs to see if you can help them augment the treatments they're offering to their patients, or is that not allowed?
Most GPs are very close-minded. I tried many years back. I think that's something I need to probably start again. But I can only start with someone who is an insider and who already is inclined that way, that they're looking to do something like that. Because as an outsider, it's very difficult for me to, even if I go and speak to GPs are not allowed to actually recommend any private medicine. It's the rules. They're not allowed to be seen to be telling anyone to go and see a herbalist, you know, because one, that they're sending patient away. Secondly, if anything happens to those people, you know, they are responsible. So I do understand that, but at the same time, I do think that GPs can liaise with practitioners. Like, I'm a qualified herbalist. So if a GP says, okay, once a week you come here, and they can always say to their patients, you know, this is a qualified practitioner, I'm licensed, I'm insured, and go and see that person, see what they can do for you. You know? Yeah. And in the past, I know that there used to be what we call primary care trust, and around the country, there were, I don't know, 8 or 10 clinics in the hospital, which were run by herbalist or natural practitioners.
Really? Here?
Well, the nearest one I know was in Whipps Cross Hospital, which is in East London. Wow. And this was a skin clinic, but that's only because the consultant was very hot about natural ways of doing things, you know. Oh. So he would do his own assessment, and I've sat in his clinic as well. This is now going back over 20 years. And then he will say, okay, we also run a natural herbal medicine clinic. If you are interested to do something natural, go and see that herbalist. That's how it should be in every GP practice, you know?
I think that sounds really good. Do you think these clinics still exist?
Whipps Cross Clinic, I think, still exists. Yes. Yeah? I don't know about the others, because I know that another colleague of mine was doing another cancer clinic, herbal clinic for cancer patients in Brighton. I mean, I'll have to find out, but I'm not in touch with those practitioners right now. But yeah, there were those clinics around the country, but far and few.
I think that's something that's definitely worth following up on. And I do remember hearing about a doctor who was treating cancer patients, and once they'd got through their main treatment, whether it was chemotherapy or radiation, then they would provide the patients with a range of supplements. And that supplement seemed to have been keeping those patients alive for far longer than if they hadn't been having those supplements. You know, so there's definitely something that could be done if traditional medicine was married with herbal or natural or complementary medicines.
Yeah.
I think that's probably your mission in life, to do what you do, but see if the wider world can also look at the alternatives, because sometimes
Absolutely.
traditional methods just don't work. I remember someone talking about the fact they used to be pretty sporty, and then they had a problem with their back, and nobody in England could help them with their back problem. They went to India, had Ayurvedic medicine, came back as fit as anything, and then he decided to set up Ayurvedic clinics here, you know, because he believed so much in it, because he proved that an alternative worked, you know.
Absolutely. I've seen dead people walking, people who were told by doctors, you will never walk again. And they're walking and they are having no painkillers, you know. A person who was in my NLP class and we trained together, he was told by doctors. He had a young daughter and he was told not to bend, so he never even picked up his daughter, and he was on morphine. Every single day he was on morphine. And he didn't even take any herbal medicine. He came to NLP class and doctors couldn't believe it. They're like, no, something is wrong. Why are you not on your morphine? And this is now going back about, I don't know, 8-9 years ago when I did NLP. And this is what we are talking about. You know, why are we not doing those things? And we couldn't believe his story. But it was true because he was right standing there. He said, I was on morphine every single day. And now I'm not taking in medicine. I'm doing sports. I'm doing exercise. I've picked up my daughter and I have no pain in the back. And doctors were just flabbergasted. How is that even possible?
Okay. Well, you brought in some new words there that we haven't mentioned today. Sport and exercise is also important, isn't it? Yeah.
Absolutely. Yeah. Two things if you can do. I think the baseline, even as a baseline, one is your diet, what you eat, and second is how you move through your day. And even if you can move somewhat, you know, every single day, even if you can do 15 minutes of active something, going up and down the stairs, even simple as that, you're going to be fit forever. You may not be athletic, you may not be extra fit, but if you have your diet proper according to your constitution and your exercise, those two things, rest is all fancy stuff you can do if you wish, but this is the baseline thing. So 15-minute exercise even daily will help you to keep fit, but you have to do it every day.
Yeah, okay, understood. All right, well, thank you very much, Dr. Ashish. This was really very interesting, and we hope it stirs some people to live a healthier lifestyle and not to have dinner, apparently. No
I'm not asking.
No dinner.
I'm not asking you not to eat. I'm asking you to have good breakfast and good lunch. Eat as much as you like, you know.
Okay, but not dinner.
But less dinner or low dinner or no dinner. But dinner, if you want to have dinner, then eat at the right time. So there is a little bit caveat to that. But breakfast, lunch, you can eat to your heart's desire because you have the whole day to digest it. So, yeah.
Okay, well, that's useful. Thank you so much, Dr. Ashish. I will put information about how people can contact you and your website as well underneath the video. Thank you for your time, and do continue to help as many people as you can, and we'll help spread the word, okay?
Thank you so much, Dawn. Thank you.
Thank you.